First, there's pursed lip breathing. You're going to put your mouth and your lips in the position like you're going to blow a kiss. You're going to breathe in through your nose and slowly out through your mouth. As I do that, I can feel the muscles in my core engage, those transverse abdominis muscles and my obliques on either side of the navel. Again, we're going to breathe in through the nose and out through pursed lips. Practice that as you exercise, and next we're going to do diaphragmatic breathing. You're going to feel those same muscles engage. You're going to breathe in through the nose and out through an open mouth, almost like you're coughing or laughing. In through the nose, out fast. That engages the transverse abdominis and you're actually elevating your diaphragm. It's just another way to kick in those abdominal muscles. Next, I'm going to show you the main breathing technique you're going to use as you exercise. You're going to hear me say, engage your core muscles and keep your tummy muscles tight through the exercises, and this is the way to help you do that. You can see here, if I have my thumbs on the bottom of my rib cage and the fingertips at my hip bones, my rib cage is going to elevate as I breathe in, and the rib cage is going to come down as I breathe out. In through the nose, out through the mouth. You can just see that elevation of the rib cage and then back down towards the hips. One more time, and then I'm going to show it lying down. Okay, practice that and then try it lying down. Same thing, my thumbs are on my rib cage, my fingertips are on the hip bones, and I'm going to breathe in through the nose and out through the mouth, elevating that rib cage. And it depresses as I breathe out. This is going to help you keep those muscles engaged as you exercise, and it's going to reduce any arching in that back. So again, it's going to imprint your spine as you breathe out. Be careful not to go into a pelvic tilt. You're not bringing the hip bones towards the rib cage. The rib cage is coming towards the hip bones. Again. And as I breathe out, I can feel my spine imprint to the mat, reducing any arch in that back. I can feel my core muscles stay engaged, and I'm going to maintain that through the exercises. So whenever I say keep your core tight, engage those tummy muscles, and keep with that breathing. In through the nose, out through the mouth. One more time. Make sure you're trying that as you exercise. Exercises Kathy's going to perform are stabilization exercises. They can be performed with light to medium weights, most beneficial about 10 repetitions. Kathy's going to perform 5 of each, and you can stop the video if you want to perform more. She's going to keep her core muscles and pelvic floor muscles engaged the entire time, and her chin is going to be down as well. This is maintaining a neutral spine, which is great for people with osteoporosis. She's going to do 4 different positions. Go ahead, Kathy. The first one, both arms at the same time. And you want to perform these slow and controlled. She's focusing on her breath, and she's keeping all these muscles engaged. And as mentioned before, we know that exercises with weights are beneficial for building bone density for people with osteoporosis. Good, Kathy. The next one she's going to go into is opposite arm, so she's going to alternate. Perfect. I'm counting on her right arm. That's 2. That's 3. And one more in this position. It's perfect. And the next one is going to be a fly. They start up in front of her face and open. Again, her pelvic floor muscles and core muscles are engaged the entire time. This focuses on the lower spine all the way up to the upper cervical. One more, and then she's going to go into the final position, which is a cross over the belly button, and then she's going to open up by her ears. Trying not to let that back arch, keeping that neutral spine. Perfect. 3 more. And last one. And again, that was 5 repetitions. You're going to want to perform at least 10.